Hi there. We are going to go ahead and talk about the types of insurance plans that you may have in terms of patient responsibility in relation to copayment, coinsurance, deductible, and out-of-pocket. Let's begin with a copay. Copay is basically a standard rate that you are going to go ahead and pay for a specific service every visit. So for example, for us in terms of outpatient physical therapy, if a patient has a $20 copay, then that's something that a patient has to be responsible for every visit. So that is copay. Next is coinsurance. Coinsurance is a percentage of the total service that a patient needs to be responsible of. So, just to simplify things, let's say, for example, your visit costs $100, and let's say patient responsibility is 20%, then the patient has to be responsible for $20 in that regard for that specific visit. And that is coinsurance. It's a percentage of a specific amount for every visit. Now, here's a little concern regarding coinsurance. Because it's a percentage, we wouldn't know what your insurance, what your payment will be for every visit. It's possible that you're only going to go ahead and pay for $75 for the overall visit or $200 for the overall visit. So, just to simplify things, at least with what we do with our practice, is that we peg it at $100 per visit, just to simplify things. And if there's an overpayment, let's say for example for 10 visits and it only costs $75 per visit, then the company is going to reimburse the patient back. But if every visit is about $120, then technically speaking at the end of the service, the patient is going to be responsible for a little bit more of the coinsurance. So that's a coinsurance right there. And just to simplify things, we peg it at $100 per visit. Now let's move on to the deductible. A deductible is something that the patient needs to cover first before insurance starts kicking in. So if, for example, you have a $500 deductible, then you need to be responsible to cover the first $500 of your office visit. And after that, if you have a copayment or coinsurance, which I just discussed a few minutes ago, then you'll be responsible for the copayment and coinsurance after you have covered the deductible, and that's when your insurance will start to go ahead and kick in. So with my example earlier, with $100 per visit, then for 5 visits, so that would equate to $500, that will be patient's responsibility first. So it's possible that you have a $500 deductible and then a $20 copay afterwards. So meaning the first $500, you as a patient, that is your responsibility. And after that, you have to go ahead and shoulder $20 if you have a copayment of $20 or $30, whatever your copayment is. And the rest will be paid by the insurance. Now, it's possible as well that you have a deductible and you have a coinsurance afterwards. So the same principle will take place. The bottom line is that you as a patient have to cover that deductible first in order for the insurance to go ahead and kick in. Now, the last subject matter that I want to go ahead and discuss right now is the out-of-pocket max. What it means is that it's possible that you have a deductible first and then a copay or coinsurance after. So if we return to the example that I provided earlier. With a $500 deductible, and let's say you have a $20 copay, so you have to shoulder again the first $500 first, and then the copay of $20 after that. But are you going to perpetually pay that copay? No, not necessarily. Let's say, for example, just to simplify things, your out-of-pocket max is $600. So you have to cover the first $500 first, and then you have to cover the copay for $20 per visit. And then, so let's say, again, just to simplify things, if every visit is exactly at $100, so the first 5 visits, you have to be responsible for that, for the full $100 per visit. And then after that, you're going to pay $20 of copay per visit. So after the 10th visit, if your out-of-pocket max is $600, after the 10th visit, insurance will go ahead and cover the 100% now. And you're not going to pay the copay anymore, and obviously you're done with the deductible as well, because you have met the out-of-pocket max. Now you also have to go ahead and consider that there are individual plans and family plans. So these are things that you have to go ahead and look into as well. Now, this is just an introduction to what patient's responsibility would be in relation to insurance plans. On that note, make sure you talk to your HR personnel, or you go ahead and call the member services in your insurance card. Now, you have to go ahead and pay attention to as well that deductible and copay and so on and so forth would be a little bit different with different medical services out there. So if you want to go ahead and ask in relation to physical therapy services, make sure when you are talking to your HR personnel or your insurance card in terms of member services, once you call their number, go ahead and identify with them that you are going to receive outpatient physical therapy services. And with that, they will be able to go ahead and identify what your responsibility would be as a patient. On that note, again, we just discussed copay, which is a set amount for every visit. Coinsurance, which is a percentage of the amount of that service for that day. A deductible is patient responsibility that you need to go ahead and pay for first before insurance starts kicking in. And out-of-pocket max, meaning if you have spent so much money in relation to your medical health, and if you have met the out-of-pocket max, then 100% will be covered by your health insurance. Now, here at AAA Physical Therapy, and again, AAA stands for Across All Ages, we do the verification for you as a courtesy. And we will try to go ahead and explain to you what your insurance covers in relation to outpatient physical therapy. But at the end of the day, it is the patient's responsibility on what your insurance plan covers in relation to outpatient physical therapy. So, if you have any shoulder injury, neck injury, back injury, if you're contemplating surgery, for example, in terms of a knee replacement, hip replacement, and if you have foot and ankle problems, please do not hesitate to touch base with us at AAA Physical Therapy. And you can call us at 443-979-7171 for more information. And our humble practice here is located in Columbia, Howard County, in Maryland. Thank you for watching this video. So again, please touch base with your HR personnel and communicate with your medical professional in terms of what your insurance covers for your medical coverage. Thank you, and we hope to see you in the next program.